everybody. My name's Tracy Wilde, and I am a physical therapist with Elite Integrated Therapy Systems inside the Prisma Health YMCA. I have been a PT for over 30 years, so during that time I've seen many patients with back issues, and I'm here today to tell you a little bit about ways to keep your back healthier. So we're going to talk a little bit about some exercises both for back mobility and back stability. Both are important. You want to have movement in your back, and you also want to have strength in your back and your core. You don't just want to have one or the other, too much of one and not enough of the other. So we'll address both things and we'll get right into the exercises. So I'm going to start with some strength or stability exercises that you can do at home pretty easily. So the first exercise that I show many of my low back patients is something called a transverse abdominis contraction. Your transverse abdominis is a really deep abdominal muscle that helps to support your low back. And the way you find it to contract it, is to put your fingers right inside your hip bones, and then you want to draw your belly button back toward your spine, like you're buttoning a pair of tight pants. And if you do it correctly, you'll feel those muscles right inside your hip bones contract. You'll feel a little movement there. You're not really moving any part of your body, you're just drawing your stomach muscles in. And you can hold this for about 10 seconds and then relax. And with all of these strength and stability exercises I'm showing you, there are 4, you can hold for about 10 seconds, and you can start with about 10 repetitions and work your way up to about 30. So again, tightening in that transverse abdominis muscle, holding for 10, and relaxing. Now, this is an important exercise. It's going to be the exercise that the rest of them build upon. So for the other 3 stability exercises, you want to tighten your transverse abdominis muscles first. Okay, so you're going to tighten those, and then the next exercise you're going to do a little pelvic tilt. So you're going to tip your hips up just slightly. Sometimes people want to lift up. Sometimes people want to push their stomach muscles out. That's not what you want to do. You want to draw that belly button back toward your spine, and you want to just tilt your pelvis a little bit so you flatten your low back into the table. So tight that you can't even fit your fingers or even a credit card under there. And again, you want to hold for 10 seconds. Stomach muscles pull in, and then relax. So one more time. Stomach in, tilt your hips slightly, hold for 10 seconds, and relax. And if any of these exercises cause pain, it might be time for you to see a physical therapist. So feel free to come see me here at the Y. All right, the next exercise you're going to do is called bridging. And again, you'll draw those abdominal muscles in, and then you're going to actually lift as you tilt that pelvis. This time you'll lift up just an inch or 2 off the table. You don't need to come way up here where you're arching your back. It's just a small lift, keeping those stomach muscles in. This exercise also works on your glute muscles, your thigh muscles, or your quadriceps, and you may actually feel it in your hamstrings as well. And again, you want to hold for 10 seconds and then relax back down. Okay, so one more time. Lifting your bottom up just a little bit off the table, and then relax down. So the final strengthening exercise that I like to use a lot with my patients is to strengthen the muscles in the outside part of your hips, which is called your glute medius muscle. These muscles are really important not only for low back support, but also for ensuring that your legs are aligned properly when you're walking. So strengthening here can help with knee pain, it can help with foot pain, and it can help with low back issues. So what you want to do is lay on one side, okay? You want everything to be in a nice straight line. So sometimes people want to let their leg come forward.
Sometimes people want to rotate their foot up. I want for you to keep your leg in line with your body, lead with your heel, so you've still got your stomach muscles pulled in, and you're just going to lift that foot up toward the ceiling. This one you don't have to hold for 10 seconds, just a pause at the top and back down. Lift up and back down. If you are doing it correctly, you won't be able to lift very high. If you turn your foot up or if you bring your leg forward, then you'll lift high, but you're not doing the exercise correctly. So make sure you lead with that heel and back down. And you should feel it right here in the side of your hip. Up and back down. And of course you want to do that on both sides so you strengthen things evenly. Okay, so that's the stability exercises. Now I'm going to show you just a couple things to help with low back flexibility and mobility. Okay, so we'll do 3 of these exercises. You can do all of them. Well, 2 of them you can do on your back, and then we'll do one in a different position. So the first one is just a single knee to chest, and all you do with this is bring one knee in. You can keep the other knee bent if that's comfortable, or to get a little more stretch, you can straighten this leg, and you're just going to pull one knee in towards your chest until you feel some stretch in your low back, and you may actually feel it in your glute muscles as well. And these exercises you can hold a little bit longer, maybe 15 to 20 seconds, but you only need to do 3 to 5 repetitions. So you'll pull in towards your chest, hold it, and then relax. And then obviously you want to do it on both sides as well. Another good mobility exercise for your low back is lower trunk rotation. And the way you do this is laying on your back with your knees bent. You still have your stomach muscles pulled in, and you'll take your knees to one side, just where it feels comfortable. You don't have to force them over there. Hold for 10 or 15 seconds. You'll feel a little stretch in your low back, and then you can take them to the other side. So pretty simple, keeping those tummy muscles in. Try not to arch your back or let your back lift way up off the table. It can lift up a little bit. So just a lower trunk rotation. Again, keeping it in a pretty comfortable range of motion. And then the last exercise that I like to use, actually there are lots of these exercises that you can do. I'm just showing you a few. But the next one I want to show you that I think is a really good one to address mobility is called the Mad Cat. And some of you may be familiar with this. You're going to get on all fours. Okay? You want your hands right under your shoulders, your knees right under your hips, and you're just going to arch your back up like a mad cat. And you'll hold this for about 15 seconds, which is a really nice stretch, really for your whole back. And then you'll let your back sink down, lift your head up a little bit, and then come back up to that arched position. Kind of tucking your tummy muscles in here too. And relax. And again, with the stretching and mobility exercises that we just went over, you don't need to do 10 or 15 or 20 or 30. You're fine just to do 3 to 5 repetitions of those. So I hope this helps. Again, if you have issues or problems, feel free to check out physical therapy at the Wilde. Thanks so much.